What are some of the common symptoms of something we read about called estrogen dominance?
Well, estrogen dominance is going to be, you know, along the same lines of estrogen excess. You know, you're gonna get the heavy bleeding, the irregular menstrual cycles, the mood, emotional swings. You know, estrogen dominance can then lead down the path into polycystic ovary syndrome, uterine fibroids, ovarian cyst. These are all things, endometriosis. These are all things where you have too much estrogen in relationship to progesterone. You could have a normal amount of estrogen and have low amounts of progesterone, and that's what's actually going to throw you into estrogen dominance and cause a host of these symptoms. So basically, we need to balance those hormones out, and guess what? The symptoms go away. And can you do that naturally? Absolutely.
Are you saying that estrogen and progesterone kind of work in a woman's body hand in hand?
Yes, they are actually, they are partners and they're synergists. We have to realize that the estrogen helps create the progesterone receptors, and we have to realize that the progesterone kind of turns the estrogen off. So one's the gas and one's the brake. So they have to work together, but if they're not in the correct ratio throughout the cycle, or if you're in menopause, if they're not relatively constant throughout that month, you're going to have a host of symptoms. So our job is to balance those out.
Well, what would be the symptoms of too much progesterone or too little?
Well, progesterone, you know, excess, you can get the bloatiness, you know, you can get some vaginal problems with it, you know, maybe vaginal dryness. That's a common thing that we may see with too much progesterone. But again, some of them overlap, so you don't just look at one, you have to look at the whole hormonal system to find out exactly what's going on. And don't forget, we have a feedback loop too, the hypothalamus and pituitary in the brain, so we have to make sure those feedback loop mechanisms are also working.
If a woman engages in choices of diet that you feel are more astute, eating more healthy foods, is able to bring her weight under a little bit more control. So dietary changes, exercise changes, stress changes. Do you think that can positively impact how a woman might experience menopause?
Absolutely, because see, when the diet is not proper and there's lots of sugars and processed refined carbohydrates, this is going to throw women into estrogen dominance. And when they are in estrogen dominance and they start to go into menopause, maybe the progesterone is dropping, the estrogen may be higher than that, and you're going to get the host of symptoms along with it. And you know, you get the heavy bleeding, or they may not have a cycle for 2 or 3 months, then they have this heavy bleeding that lasts 5, 7, or 10 days. That's because of the hormonal imbalance there, and by correcting that, and the key is to test them. We should be testing women when they're young to determine a baseline on what their hormones are, so that as they go into menopause, it can be a natural transition.
What is a progesterone cream test? And we have a slide 6E to take a
Well,
look
basically what this slide is going to depict here is that a lot of women use progesterone creams, and a lot of times when you put the creams on, they can build up in the subcutaneous tissue underneath the skin. And what this slide depicts is basically, you can see the top line there, that's someone who's doing a saliva test who's on progesterone cream. Now, when you do a blood serum test, you're going to realize that a lot of times the progesterone levels won't be as high. So, you know, these progesterone creams can be very bad for women. As you can see by this slide, it's not even close. It's way higher than the estrogen, and this woman has a lot of different problems. So the first thing we need to do is get them off their creams. I'm not an advocate of progesterone creams. As you can see by this slide, it can throw your hormones totally out of imbalance.
Physicians, which typically include MDs, medical doctors, DOs, osteopathic physicians, they want to help people with their health. They've gone into medicine, made many personal sacrifices to do the right thing. Alternative medicine professionals, such as yourself, have also gone to school. You've studied, you've worked hard to learn what you know about how changes in diet and exercise and vitamin supplementation and some novel approaches to menopause, for instance, how they can be effective. But there's a gap, there's a difference between those two perspectives, between the world of the allopathic and the world of the natural. And many physicians are perplexed because more and more and more women are coming in their offices and they're saying, have you read this? Have you read this? Have you read this? What about this? What then? And a lot of them have said, gee, I'm just having trouble keeping up with the questions a lot of times. What is the difference between the two approaches, okay, of the alternative medicine versus allopathic, let's say?
Okay. Well, the approaches are different, and basically the approaches are what we were taught in school. And we have to realize, I guess one of the best things I could say is, let me give you a story. I had a doctor come in to me. She was an OBGYN, and so was her husband. And she came in and she said the exact same thing. I went to medical school. I thought I was doing everything. I'm here to help people. And from what you're telling me, I'm really not doing what I think I can do, because you're telling me there's more to it. And I said, yeah, you're exactly right. And within 3 months, I had this lady who was on disability totally back to working, cycles totally regulated. And she said, you know, there is more to this. So I think the biggest key is that the education. And we have to realize that a lot of times education in medical schools, you know, if you have a disease, then there's a drug to fix that disease. And we have to realize that a lot of the protocols written for medical schools are written by doctors who are on the pharmaceutical companies' payrolls. And that's public knowledge. It's out there. And so we have to realize that the alternative aspect of it is that we approach it from a different standpoint, and we let the body heal itself by balancing the chemistry. If we balance your chemistry out, the body will work the way the Creator designed it.
As I'm sure you've guessed, America is in the middle, really, I think, of a redefinition of certain basic ideas relating to medical care. Number one is, do we have a personal responsibility? Each and every American, each person, do we have a responsibility to take the actions which maximize our health, which means don't smoke cigarettes, don't be drinking to excess, don't enjoy junk food too much. These are the things. What's happening in America today from your perspective relating to this kind of redefinition of how we're going to approach our health?
Well, I think the greatest thing that has happened is, number one, we have the internet out there, so we have the information at our fingertips, and that's why these doctors are getting inundated with questions, because people are looking up their problem and they're coming in with questions. Number two, there's people out there writing books to expose what alternative medicine is and some things that actually work in it, so people are more aware, and awareness precedes change. So I think what we can expect is that the public needs to be part of it. They need to educate themselves, and they may need to take an active role. I'm not saying they need to be their own doctors, but they need to take an active role, because I tell my patients, I'm just your health coach. You have to do all the work. I'm going to guide you down this maze of information and this maze of different things that can go on, but ultimately you're the one who has to shop. You have to eat properly. You're going to have to take your supplements. You're going to have to stay, if your doctor recommends, stay on your medications, and you have to do all those things. It's a combined effort, but ultimately I think it's going to reshape, and I think we're going to see some major changes in the next 10 to 20 years. And I'm looking forward to it, because I think it's going to be positive.
Well, wonderful perspectives from Dr. Unger relating to alternative medicine in America. And I think, as they say, when it comes to the behaviors that we Americans can take to improve our health, we haven't seen anything yet. See you again soon on Medical Matters.